so that we can really focus in on their work and story. So I think it's really hard to understand what the opportunity is with a health impact assessment is without looking at a definition of what health equity is. And this definition is from the Minnesota Department of Health's definition on health equity. When every person has the opportunity to realize their health potential, the highest level of health possible for that person, without limits imposed by structural inequities. Health equity means achieving the conditions in which all people have the opportunity to attain their highest possible level of health. And what I think is so important about the Department of Health's definition, it's not about the absence of disparity. It's about people reaching their full health potential. And I think that is something that it's really important we just hold, because depending on the lens or your approach and what you're trying to achieve, really shapes your work and whether or not you're really making progress towards that end goal. The other concept I think is really important to understand is this piece around social determinants of health. Oftentimes when we think about health, we think, especially around improving health, we always hear about the public education campaigns focused on behavior. Like if you just change your activity in this way, your health will improve. But in reality, when we look at a population's health, how long people are living and the quality of that life, we're really looking at factors that we as a community have control over, around social and economic factors, around education level, employment, income, family and social supports, and community safety. So these are shaped by policies, things that we collectively decide upon. And instead of, which typically we hear around health and improving health, really focused on individual behavior, there's this piece around what are the policies and systems that we have in place and how are those shaping those health factors that impact our quality of life, how long we're living and the quality of that life. So as we're moving forward and we start looking at health impact assessments can be a tool to really look at things that are broader sense, not just one sort of siloed issue or health factor. So again, it's important to remember personal behavior is only 30% of a population's health. The other 70% come from other factors that are somewhat under our control, that that are created. So in the Minnesota Department of Health released a report really calling out structural racism as a cause to health disparities in the state of Minnesota. And in this report, it gives an example of the practice of redlining, which took place from the 30s through the 70s. And this was communities that were redlined. This resulted in disinvestment. It influenced how mortgages were, who received them, who did not, and it disinvested from specific communities in Minneapolis. This map up here is a reflection of that 1930s map. When they in 2010, looked at infant mortality rates in neighborhoods in Minneapolis, the areas disinvested in during this period of time also had a higher level of infant mortality. Now, there's multiple factors that contribute to that, but this gives you an idea that policies and systems really shape where we are present and our health, and our overall health and our community's health. Now, this map, and the reason why I'm showing this is that when we talk about policies and systems, we oftentimes, especially I come from a community organizing background, so it's oftentimes around campaigns or wins of different things that happen. So from that period of redlining from the 1930s through the 1970s, that overt policy of discrimination was taken out. However, there was 40 years of practice and criteria developed around that system. And this report just came out here in this last November or December, talking about how we are still having redlining taking place and how loans are actually given out. There's a racial disparity in who is receiving subprime loans and prime loans, who's being qualified and disqualified. which is continuing this disinvestment in communities. And this is a deeper practice. And I think it's really important that the value of doing a thoughtful piece around policy is not only looking at what you're changing, but what's the deeper implication within the institution or system itself. Because those deeper, the actual practice within the institution also needs to change, or we're going to get a different health outcome. So a health impact assessment is a little bit more flexible of a tool, where you can take into consideration multiple factors. So HIAs are intended to really inform deliberations on a specific proposal. The opportunity to use an HIA to inform a specific decision that's taking place, a project that's underway, and those projects can be a transit-related project, development, air emissions, or a permitting issue, really looking at what's the consequence of that policy and what's the implication when it comes to health. The other piece is that it can systematically assess multiple influences of health, not just one single issue. We all know that in our life, our life isn't segmented. There's multiple factors that impact our well-being. A health impact assessment in that process, by working with stakeholders, allows you to look at those other considerations and how they interplay and interact and affect one of the decisions that are on the sort of the table. The third thing is that it uses a broad definition of health that includes physical and psychological health and general well-being. Okay, because oftentimes you're doing like a health risk piece, or people get really focused on what's the biological impact that it might have on people. There's also other factors to our health just beyond just sort of the biological part. It's the psychological and general well-being of the community. How will this decision impact our social networks? So those broader pieces that contribute to our overall well-being can also be brought into consideration on how a policy or decision will impact. So this is really just a kind of a formal definition of a health impact assessment, that it's a systematic process that uses an array of data, sources, and analytical methods, and considers input from stakeholders to determine the potential effects of proposed policies, plan, program, or project on the health of the population and the distribution of those effects within the population. The other key piece is that the health impact assessment provides actual recommendations as to how to improve health and how that what you can do to actually improve the decision making and also the implementation of those policies. Health impact assessments follow kind of a set sort of process. These are the 6 steps to them. Screening, is this particular decision or project the right time to use a health impact assessment? The scoping, so really working with stakeholders to develop a plan, including the identification of potential health risks and benefits. So, I mean, that's the other piece. Oftentimes when research happens, it's done in a vacuum. The health impact assessment throughout this process is supposed to encourage public input at each step. So oftentimes, so when you're including the stakeholders, people most impacted by that decision, they may say that how you're framing this research doesn't work for us, and it needs to be adjusted, may need to include other factors. Then there's the actual assessment, identifying baseline health pieces, and how will the decisions that are being considered impact the community's health. The development of recommendations. And that development of recommendations also needs to really include community in that process as well, to know that it's really having impact. The other piece around the HIA is that there should be a very proactive reporting. So not just the production of a report, but the actual proactive distribution and presentation of what the findings are. And I think this is really important because oftentimes we think about, we produce these reports, they sit on a shelf and disappear. But the process should really make sure that this reporting is a proactive one, that it's brought out to community, that it's used to really inform policymakers and decision makers, and that it's doesn't just simply become a quiet internal process. And then there's the ongoing monitoring and evaluation. So there's just two other sort of concepts I'm going to touch on that I think is really important. The last slide, with health impact assessments, this idea of community input throughout the process is referenced. But community input means a lot of different things to different people. And there's different levels of it. And it's sometimes different than community engagement. But this is just kind of an example of some different levels of community participation. Informing is when it's just one way, when it's education, sort of that public health education piece around personal choices. Consulting is when it's about gathering input or feedback on the project, but people don't necessarily have power in what's happening in that process. When people are involved, people are involved throughout the process. Their concerns and hopes are considered in the decision making on the project. When there's actual collaboration with the community actors, community is actually involved in the decision making and developing of solutions. And the reason why I'm kind of bringing this up is that as people present, then you can, when they talk about input or that community was involved, then you can think to yourself, at what levels were they involved? And get some clarity on that, because that I think also shapes the quality of the health impact assessment, its benefits to the community, and how it will actually live beyond the project itself. And then the last piece was just to really provide a definition around racial equity. Because health impact assessments, I think, are a really powerful tool, but they are often still done within institutions themselves that have not incorporated racial equity as a core principle. And simply because you have a good process doesn't mean that you're going to address or really promote addressing racial inequities or result in a project that's going to advance community health. So we need to be really deliberate in our work within these institutions to make that happen. So in this definition, when we use the term, we are thinking about racial equity as one part of racial justice. And thus we also include work to address root causes of inequities, not just their manifestations. This includes elimination of policies, practices, attitudes, and cultural messages that reinforce differential outcomes by race or fail to eliminate them. And as the presenters here tonight, I think listening closely as to how they incorporated and use a racial justice lens in the level of thinking or planning, I think that can be a really educational opportunity for all of us, and I'm looking forward to learning how folks have incorporated that and how that might have influenced their projects and the work that they're doing. So I know that was kind of quick, but really the three presenters I think are doing some really great work, and I didn't want to take too much time from that. Are there any questions that you have regarding some of the content that I just went over?
We've talked about the fellows have talked about the development of the reform plan, and we've heard from some people that are doing work around that. Do you know if they're considering this work, or who's leading that on behalf of that development?
So the question is whether or not they're considering using a health impact assessment to evaluate how they might move forward on that project or do that development. The answer is I don't know the answer. I think it's important to know that with health impact assessments, they're not required.
They're not what?
They're not required. So they're optional, something that people do by choice. Unlike an environmental impact statement, which is required for sort of a development of that scale. There's been a lot of work trying to incorporate health impact assessments into environmental impact statements, because those EISs, those environmental impact statements, do have a piece around health, but it's really more focused on biological health than these broader pieces. So there's been an effort to try to include this broader definition of health and assessment into that work, but that's still pretty new.
to dovetail on his question, we know that environmentally, there's been a lot of impact to that piece of land there over the years that the Ford plant was there. So it would have an impact on the health of that neighborhood. Because while that plant was there, it impacted the environment with the spills into the river, the soil, I mean, anything and everything that was there. So, I mean, I know you said the answer, you don't know, but I mean, at the same time, I'm wondering, because I really don't see it in the way that they went about the planning for that piece of land, that there's racial equity involved in it as well, because it is in a primarily white neighborhood, and all the businesses up there, I mean, if they don't know you, you know, you're looked at suspect. So I'm wondering, you know, the city and the neighborhood itself and the people who are building there, you know, why is it that, you know, if the city put all this money into it and they tore down all these buildings, now here we don't have something in place that's going to impact the whole environment, the whole neighborhood, and the surrounding neighborhood.
Yeah, and the only thing I would sort of add to that is that this piece around the health, the HIA being attached to a development of that piece allows you to perhaps use it as a more flexible piece instead of just looking at sort of the environmental impact of that particular piece of real estate. How is that redevelopment and that investment promoting health equity in the surrounding community or the broader region? So that opens the door for those conversations around employment. If there's going to be housing in that project, you know, what would that look like that in a way that would be positively benefiting the broader community? Is, you know, one possibility.
Larry, I just have a quick question, maybe about recently, there's been this very popular, some very popular work that's been going on, mostly out of Harvard and some other places around people living in poverty and DNA changes. The actual, and right now Ramsey County Workforce Solutions has a waiver from the state looking at people that are receiving MFEB and a more inclusive, looking at their lives in terms of jobs, right? Mm-hmm. So I just wanted to hear if there's the connections with this work and that work, and if there are any. And I tend to think that being a conspiracy theorist or whatever, that stuff that's popular may not actually be, but
well,
I'd like to hear if there's something, what the connections and what the work is.
Well, and maybe the panelists might be able to speak to that, but I think this broader piece around how our social condition impacts our health is pretty, there's a lot of evidence around it. We all know if you're more stressed, how many of you have heard, you know, stress will kill you? How many of you believe that? You know, if you're struggling on a monthly basis to make rent or a house payment, that has a huge impact on you, your well-being, your relationship with your children. Money is a number, you know, is the top 2 or 3 when it comes to divorce and separations. So when you look at sort of these economic policies, sort of, you know, as we talk about the subprime lending within the community and how it's targeted in some regards, and the impact that has on just family structure
And that
and well-being.
I wasn't disagreeing with that.
Oh no, I wasn't suggesting, but
I was really looking at, I mean, what they're talking about is how someone that has grown up in poverty, that their DNA changes so that their child, whatever the situation their child lives in, continues to have that DNA stressors within their self, and that it has to be undone in order for that next generation or themselves to be, and that's, and so it's, I mean, it's all related to the health, but.
That's an intriguing work, and especially when you know, considering the pieces around historic trauma and other parts. So, are there other questions? Yeah, if not, I mean, for me, I've been going through my own learning curve around the incorporation of health and health equity in work. A couple years ago, when I had first learned about it, I really saw it as more, it was like new language. It seemed a little bit confusing, and I thought it was more of a funding transition. And at once, learning more about it, and I think this piece around health being, it's this body of work is going to be around. And the second part is that what greater way to really evaluate our success as a community and society is by how long are people living and what's the quality of that life. And this piece around health equity, putting that out at the front and center, I think is a very powerful lens. It's not the only lens in which we should be evaluating our work, but I think it's an important one that should be a part, more a part of it.
Thanks, Larry. If you've been to one of our series before,